Well, in my honest opinion, near-death patients need their loved ones more than hospital machines. Before I had this patient, who was 22 years old, he was sent here after a car accident. For more than 3 hours, the hospital wouldn't let anyone come in and visit him in the ICU. Only one family member can visit for just 5 minutes, only after 2 hours. In the end, we weren't able to save him and he died. The family members were really upset because they thought in his last moments, the patient wasn't able to see them or talk to them before he died. That's why, for all those near-death patients, what doctors like us should really do is to help them instead of trying to save them.
But then, Dr. Ouyang, how is that we're able to lessen the patient's suffering? Is it still necessary for emergency treatment?
Of course that's very important. We'll save them if we can. Nobody's willing to just stand by and watch their loved one pass away. But as for those patients who already have those terminal illnesses, or for those who can't be saved through treatment, using those hospital machines to extend their lives will only cause their suffering even more. Aside from what I mentioned, near-death patients are often very dehydrated. Their circulation's poor, they can't swallow food properly, that's why their bodies feel cold. They're more damp compared to other people. We often think that they just feel cold, so we give them a blanket to keep them warm. However, even if we only put a light blanket on their hands and feet, they'll just find it very heavy. They can't stand it.
Give the patient a lighter blanket.
Respiratory failure causes them to have trouble breathing, so giving oxygen might be our choice. But these patients have already lost the ability to utilize oxygen. So the best thing to do is turn on a fan or simply open a window. In order for the room to be well ventilated, then you can give the patient morphine or some other opiate or synthetic narcotic. These patients won't be able to eat or drink if they have a hard time swallowing, so lots of families will use a tube to give them food and water. But the truth is, near-death patients won't feel hunger. On the contrary, continuous dehydration and malnutrition will eventually cause their ketone bodies to accumulate, which results into a natural painkiller that will make them feel numb. However, if we give them even a little bit of glucose during this time, the painkilling effect will be lost. Feeding the patient will cause them to vomit, or the food might eventually cause them to get choked. And if the patient struggles and doesn't cooperate, then there will be no way that they can die quietly. Although infusion somehow relieves dehydration, it has negative side effects like swelling and more pain.
The patient is having a hard time eating. Head Nurse Lin, should we intubate her now?
No.
We know 56% of patients are conscious a week before death while the rest are drowsy, but never in a single case has it happened that they were comatose or completely unable to communicate with others. That's why family members should take this opportunity to talk to their sick loved ones and not wait until it's too late. But these are just some of my personal views. As for what we should do, I can't tell you